Does trauma therapy have to be brutal? No, it doesn't. Actually, pretty much all of us have trauma, and we can go into it gently. In fact, that actually is the plan. We want to touch the edge of it. And we don't need to go into all of the story either. We can actually discuss where you hold that in your body, in your abdomen, in your belly, in your solar plexus, in your chest, and can often discover where we feel it and the reactions that happen when we start to get close to it. Right? Typically, if there's trauma in the system, somebody pushes your buttons and your response is disproportionate to the event, which is how you can tell there's trauma there. And so we can dive into some of that, but we can do it slowly. We can do it at a pace that works for you. It isn't about my agenda, it's about what actually makes the most sense for your nervous system. And we step into it, we step into the edge of it, and then we can pull back. And this act of pulling back is called titration, where you soothe yourself, where you bring your heart rate back down, where you find different activities that help you feel safe and secure. And then often you can step a little deeper into it next time. But it's not like one size fits all. And there are many different paths to step into trauma. You just have to find somebody who you feel safe with. And then all of it's possible. And as that trauma gets stepped into more, our reactions get smaller. We become more intentional. When when difficult conflicts arise, it's like the adult ends up running the show rather than that hurt little kid who reacts like it's the end of the world. And so then our nervous system gets to chill out even more. And ultimately, this is about you becoming more true to yourself. Because when we have those big reactions, we feel awful afterwards because we didn't act like ourselves. We didn't act in alignment with our core values. So, doing this type of therapy, that's the goal. Become more true to who you are, connect more with your heart.